Okay, well, we're obviously going to talk about lumbar disc herniations. I decided it'd be a good topic for us to learn more about. I honestly thought of it because of my sister's dissertation. That's kind of like, she did it on lumbar disc herniations and like re-injuring it of the different back procedures, like surgeries. So that's basically what she did it on, but it just got me and I was like, oh, we have a lot of people who have back injuries. And I thought maybe if we learn more about disc herniations, it'd help us. So I actually have a video. So let's watch this video really quick. Hold on. Okay. Okay. Just a minute.
Intervertebral disc consists of a thick outer band with a crisscrossing fibrous structure, annulus, that surrounds the soft gel-like center, the nucleus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gel-filled nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. This is the condition of a normal lumbar intervertebral disc. As a disc degenerates and breaks down, the inner core can leak out through the outer portion of the disc. This condition is known as a disc herniation, which puts direct pressure on the nerve. Lumbar herniated disc symptoms include low back pain, legs and buttock pain, leg numbness, and tingling.
So it's just a little like snippet of what a disc herniation is. So this is actually like your healthy disc, right? So no bulging or herniations or anything like that. So yeah, so that's that. Let me see. Okay, so two causes of a herniated disc. So you can have degeneration. So basically as we age and we get older, so just walking, right? A lot of times if I had like 100 more pounds on me, I probably have more likely of a chance to have a herniation, right? Just because of that load. We'll talk about like different compression and flexion and extension. And then a trauma. So I could lift something heavy, right, without paying attention into the limit of normal flexion, right? So meaning I'm here and I'm bending my spine where I don't want to into that lumbar. So this is also then just another, I like this picture, shows you the normal disc and then the herniated disc. And basically just like the video said, it's the leaking matter into that nerve and then into those faucet, those are your faucet joints. Facet, thank you. Goodness, your facet joint. This is a discussion, okay? All right, so this is what I was talking about with the spinal loading and then the spinal motion. So like someone who is heavier, right, when they walk in and they say like they have back pain, right? Think about it, they're compressed all day, every day. So they're already more likely at a chance of having a herniation or some sort of like back issue. So it's a stressor that they have. And then also flexion and extension, right? So extending forward and backwards. That's just another, like if someone does that all day, every day, that's another stressor that's being put on their spine. Yeah.
Is there like,
Sorry, go ahead.
Yeah.
Yeah.
Research on like weight-wise, is there a certain weight that more people have disc herniations with?
So that I don't know, and that I feel like would be something, that was what I was gonna actually have us discuss is like, so if we know that person A is more overweight, like how can we test like they can handle this amount of load? Because that's something I don't know and that's something I didn't see.
The external load.
Exactly, right? Because they're already loaded, so maybe they only need a body weight squat on their spine because they're are internally loaded so much.
But I imagine just like anything, it could be progressively overloaded to where when you come in, you're at a different place where you're a month from now.
Exactly, right? And so that's why like at the end, like what I was thinking, like going ahead is that maybe like every six weeks, like there's some way that we can test that person, like, okay, like you can sustain a little bit more load because we got you to this point, yada yada. But like that's what I was thinking would be like our like discussion on it would be like, okay, how can we get this person here? So I found some articles. So this was a really cool article. So what they said was, how can I read this? Okay. Basically, what'd you say? Can I? Nope. Nope. That's okay. How do I get out of that?
Go down to the top and yeah.
Okay. So, approximately half of old lumbar discs degenerate in the sense of becoming physically disrupted. So what we talked about with that, the load, right? However it is. The lower lumbar discs are most affected because they're most heavily loaded, right? So what we talked about, age and genetic inheritance can weaken discs to such an extent that they're physically disrupted during everyday activity. So a lot of times it has nothing to do with what we do, what that person does. It's just that's how they're built, right? And then what they found was that some discs degenerate because they're disrupted by excessive mechanical loading that can occur without trauma. So if they're weak, so their tissues are weak. So that's a big reason why I thought of this. So we'll talk about like the tissues that I think we should focus on. So their muscles, right? So their posterior back muscles. And then this article, I don't know that I need to click on it, but this one talks about, so it basically talks about everyday activities, right? So if they, I don't know why it's not working. So it was an article to discuss if I can give them like stabilization activities, like lower back, like they did the one with Barba where she's laying on her back and she's sliding out the heel slides, that one, stuff like bird dogs, any sort of stabilization. They did a study and that study showed that group A who did those exercises over a certain amount of time, they had lower back pain. So it just proves that like, no, it decreased their back pain versus those that did not. So stuff that we already know, but it's just kind of cool to see like, okay, like there's a study done on it. Okay, so this is on your disc. So this is where I was talking about your muscles that I want to talk about attached down into those facets, into your facets. This is why I'm not a teacher, okay? So if we're weak, right, you're gonna get more of a load there. And something cool that on my sister's dissertation, what she did it on was she tested, there's different procedures where like open back procedure or where they just stick a couple holes in you. And what it tested was, and when you do an open back, they actually cut open, I'm forgetting the name of the actual bone, but they cut open that bone, so that's taking away some of your structure, right? So some of your support. So that's actually leading to more, you could re-injure, get a re-herniation. So knowing if someone had like back injuries and if they had an open surgery would be beneficial for us because then we really need to make sure like, hey, we don't load them like excessively for their lumbar, on their lumbar. Does that make sense? Maybe a little bit. Okay, so Caitlin, how do you pronounce this word? Multifidus. You don't understand. Last night I kept on reading this. It's like multifidus. Okay, so so one of your posterior back muscles, so your stabilized muscles. So this attaches along your vertebrae. It stabilizes the vertebrae on the spine when the spine moves and is one of your like core muscle stabilizer muscles. It's also active in all anti-gravity anything, right? So standing, right? That's a muscle that helps you just stand. So something that I like, one exercise I thought of was bird dog variation. So like any bird dog variation we do, that's going to help activate and strengthen that muscle. But anything, honestly, anything standing upright, right? Getting them to just sit and stand upright, it's gonna help that. But also the next exercises for your erector spinae will also, in my opinion, work your multifidus, your M muscle. Okay, let's call it your M muscle. So I actually didn't know this, but do you know that your erector spinae is composed of 3 muscles? I didn't know this either. So it's, you have your, again, I'm gonna butcher, spinalis, longissimus, and iliocostals. So they're called all of those based off of where they're located on your spine. So they function to extend and laterally flex the spine to the same side. But again, right, this goes back to if we can strengthen those, it's gonna help decrease that load on the faucets. We're just gonna call it faucets, okay? So a few exercises that I thought would be great to program for to help keep those, nice and strong. Physio back extension holds, anything floor tall seated, right? So anything here like shoulder press because I'm working tall through that spine. Bench back extensions holds. Roger, help me. Heather, you do this one a lot with the barbell. So like laying this way on the bench and just having like a coach is holding the legs. And it's basically another way of doing the back extension, but a little bit more progress. Good mornings, right? Single leg banded A's. So I'm standing on one leg with a band. So I'm working, right, my M muscle, and then I'm also getting those erector spinae muscles as I come all the way down and back. And then Chinese planks. So, yeah, I learned that one. I can't remember his name, but yeah. I mean, because think about it, you're using those anti-gravity muscles, so you're. I mean, I think so. What do you think? No? Mm-hmm. Yeah, like.
So is there just what is the A part of it doing? Is it more of the fact that you're sitting on the leg that's doing that?
Well, no, because you're moving your limbs. I mean, because if you just stand on one leg, I don't think you're really working your.
So then what's the difference between a 2-leg A and a 1-leg A?
More instability. Does it change the erector activation?
You're saying that it obviously creates more instability, but where is it creating more instability? Your hip.
Oh.
Yeah,
No, yeah. I mean, I think of course it's working all of like your instability through that single leg, but I mean, you are still getting.
I guess what I'm saying is we do a lot of banded A's, so those people should already be getting
The back work, yeah.
But not saying that's not good progression. I think that it wouldn't be my first go if someone has back pain.
Yeah, it would be I think it'd be more like a progressive. Like if someone's like flared back pain, I would not program that whatsoever. Yeah, at least she's staying in the same area. I think too, had a thought on that one and I just lost it.
Wouldn't it activate more because it's trying to keep you upright?
That was my thought, yeah.
Trying to keep you up as you're trying to down.
Yeah, but I think too though, like it definitely would need to be more like progress, like someone doesn't have back pain, but they have a history of disc herniation or something like that.
This subject can get derailed really easily because it's like you can actually also have back pain from overusing those muscles.
Exactly, right?
So then you're looking at it from a whole other perspective of like, I shouldn't be doing any of it.
No, so this is just activation with those two muscles. You actually also need like a lot of like back extension is great for the disc herniation, but it also depends on the person, right? So like Heather could have a back lumbar disc herniation and I could have a lumbar disc herniation, but we have different symptoms. Like some people don't even have symptoms for disc herniation, some people do. So it depends on, what's going on. And if they have, say they have sciatica nerve pain, just because they have sciatica nerve pain doesn't mean they have a disc herniation.
Right. That's why I think like Instagram has a lot of BS when it comes to back pain, because a lot of it's like, this will fix your back pain, this will fix, like, but like what is causing that back pain? Is
Yeah.
it instability? Is it weakness? Is it overuse? Is
Yeah.
it disc herniation? Is it more than, like, is it a slip? You know what I'm saying?
Yeah.
That's why like my issue is turning my back off.
Yeah. So like this would not work for you whatsoever. But I think just like getting another idea of like a different way, like maybe it's like a trial and error thing for someone. So if you know they have a disc herniation, these are 2 sample programs I came up with. So sample 1 for set 1. So I was bird dog row, right? So I'm working stabilization. I'm also working unilateral. I'm working core. So I think personally that if someone has any history of back pain, I'm thinking like more core. And I wanted to know y'all's thoughts. Like, do you think like they need more core? Do you think not? Like, I know we have always said like every exercise we do is always a core exercise. You guys look really stressed right now. But I don't know, like, what do you guys think? Like, do you think that
I think it depends on the core muscles.
on the core muscles?
Yeah, because I mean, the problem with someone that has like an unstable spine in the idea of those muscles probably overuses their obliques. Like,
Okay.
that's one of the things I'm learning a lot about like myself is that I have a lot of like anterior pain too. I have a side of my like frontal like lateral pain because I overuse my obliques because my like transverse isn't doing anything. So it's like you also have to kind of find a way of diagnosing like
That's the thing.
is someone overutilizing more major muscles like their rectus and their obliques because they're not utilizing some other core muscles. So it's like just to say, I mean, that's why back stuff is so complex. Like that's what him and I are talking about. Like it's so broad. Like no one person is ever going to be treated the same.
No.
So
Yeah.
to say, hey, you have back pain, let's do a side plank. It's like
I think it also depends on activity and activity lifetime.
Exactly. Yeah. So like if someone sits for so long, they need to be doing more of yada yada yada. But like, how can we? Like, I was like trying to think. I was like, how can you test someone's like different core muscles or like core in general? Like I was like minute plank, but that's not really even testing their core because they could compensate, they could cheat, all of that. It's like I struggled on trying to find a way of like something to do to like try to.
I think a lot of people struggle with engaging their core correctly, too.
Yeah, like.
Saying, deep on the face and the sides of your core rather. Like the more I've been coaching here, the more I realize that people don't actually know how to brace properly with the right muscles.
Yeah.
So if they're doing a core exercise and not doing it right, they're cheating on it, or they might think they're doing it right, but compensating. But it's
Yeah.
very technical.
Yeah. Speaking of bracing, so Heather and I were going over some of our rehab exercises and like the core bracing. So when I was like reading up on this stuff, I was like, oh, it makes so much sense. So Heather's physical therapist said, don't press hard into the floor.
I want to be in like a full pelvic.
Yeah.
I want to be in like a neutral spine.
And so it makes sense when you think about like stuff like this, right? So anytime someone goes into that flexion, that's probably how they've injured their spine, right? Because it's pressing onto that that part of their spine and onto that nerve.
Really hard against the ground.
Yeah, so like going like heavy here and like just pressing into your spine, that's actually probably working counterintuitive on what you want to do, right? So what Heather, right, we did those clocks, the 12 to 6, and then like what her physical therapist was telling her was like find that neutral spine and then press in. So I don't know, I thought that was really interesting.
Well, yeah, I mean, even months ago, Taylor did like, had me do dead bugs.
Yeah.
And to stay in a neutral spine. I don't have pain on a neutral spine, but I have pain on a flex spine or an extended spine.
Yeah, and like
How do you measure a flex spine? Neutral compared to flex spine?
their pelvis. So like you would, but see in that, and I think that goes into too, like it's easier to see it on Heather, but like someone that's like 3 times Heather's size, it's hard to see. And that's what I want to know is like, how can we figure out that on someone that is heavier,
Or the only reason I'm
because
saying
they're,
that is because then you can get outside, if you know like a pressure gauge, you know, you can't see the back, but you can see the pressure gauge. And you can pressure gauge everybody to get the certain pressure.
yeah, yeah, I guess that would work, because then you could say, okay, do you have pain here? Like, you can ask that way.
Certain pressure.
Yeah, that would work.
I think there's also like a lot further regression that we can take with core exercises that we don't think about.
Yeah, like with breathing involved.
Well, in both
Why would you
depends.
regress it? When you starting out, or when you have somebody with pain and then you're like, okay, we can't, this is hurt.
So you can look at it from either perspective, because it's like Caitlin says, you can have someone who has zero pain, but then they do a core exercise and you're like, okay, you should definitely be feeling this here, and they're like, no, I don't feel anything. Or like Lauren and I were doing like a chop beat yesterday, and she's like, no, I feel that. I'm like, how? I'm like, I'm fire. So it's like, it could be a good way of just helping people, like someone that's already fit, reorient themselves with their own core muscles. And then you look at it from an injured side standpoint, you're like, okay, this is actually something they can do that I'm not going to create pain in, and they might better understand their body.
Mm-hmm.
So, what? Well, we're not talking about it now. I'm just saying.
Yeah.
Places to go.
So yeah, so I was thinking through here, this would be just a simple, and maybe even if they don't have a disc herniation, just a simple like low back pain to begin with. But yeah, bird dog row, plank dumbbell pull through, right? You can regress and progress that one based on the person. Step up, right? Same thing, regress, progress, weighted, non-weighted. TRX row, floor seated dumbbell shoulder press, Canva banded lateral walk, suitcase hold, opposite leg lift. I feel like that is definitely for someone like maybe Danielle, right? If we knew that she had a disc herniation. But if someone's like fresh, they have so much back pain, like no. Just because I think it's too much of that, the whole like sample program. Like I think it's just too much load than what they're used to. So I would think like retraining them, like what Heather said on like feeling the core properly, and then less weight, right? Especially if there's someone that's a little bit heavier, overweight, because they already have that compression and that load on their spine. And then sample 2, side plank banded row, physio ball triple threat, right? So you're getting those spine muscles, you're getting core, and you're working hamstrings. Push-ups any way that they can. A bear crawl row, goblet box squat with appropriate weight, right? So you still want to load. So everything I saw, right, you still want to load the spine. So we know the name. So want to load so we don't lose it, right? We want to load our bones so we don't lose them, but just keep it appropriate. And then elevated hip thrust with single arm chest press. If I say that, does that make sense? Yeah? Okay, cool. I was worried. Because it didn't make sense at first when I said it.
So,
Like, because,
it could be the same client, or we do have 2 different examples of client, and that's 2 different.
say that again?
Is this 2 different scenarios, or is this?
So this would be like 2 different days, but like,
Okay.
I think it would be a similar type of client. So like, and then if someone had like a flare up, this is what I was thinking, like more like mobility through their spine, like, and you're basically just trying to like decrease pain, but still get them moving. So wall pat down, right? Everything I saw, like extension through that spine usually feels better on someone with a disc herniation. Bird dogs, right? You're supporting their core, but still getting some sort of, muscle activation in. Reverse hypers, but making sure they don't extend loaded, because then that will put more of that because our leg, we're usually like heavy set on the legs. And then seated banded row, prone press ups, right? You're getting another extension. Supine sciatic nerve flossing. Obviously, this would be really beneficial if they have like sciatic nerve pain.
What is that one over?
So that's the one we had in our warm-ups. So I'm here, and point, let's. On your belly. Okay. So you're just laying, so it's supporting your spine. And then knee prop single leg RDL, so you're not putting a lot of load on. I actually saw this one on that knee prop single leg RDL on PhysioFix. She does that a lot with.
I think the issue with that kind of stuff is taking stability.
Yeah, yeah. Like on the leg that's elevated.
The person has to be almost a perfect height, you know, like you need to either have to adjust the bench or adjust the person.
I did do that with Alex. Alex had that, and when I adjusted her to one of these boxes, she felt more comfortable than the bench. Spinal wave, knees down version, huh? Spinal wave, knees down version. Weighted alternating bird dogs, right? Because you're getting that extension. It's kind of like hanging, but then you're still getting activation. Femoral wall squats, box seated pull downs, ISO single side dead bug. So pressing and then extending. So you're getting that cross activation, and then also you're still working, right, your spinal muscles. Back extensions over physio. Yeah.
With the deck bug though, we want to touch that with their back pressing into the floor. So if someone has a flare up, wouldn't that theoretically possibly cause more pain?
We wouldn't really would push it.
We put it to the main here and doing a dead bug. I'm pressing my low back into the floor.
Especially if you're creating pressure.
Yeah.
Yeah. I mean, you can have them relax their head down, still find that neutral tilt. But yeah, I mean, if it's painful, then yeah, no, you wouldn't do it. That makes sense? And then, well,
I think a big lesson or a big takeaway from that is like sometimes creating too much flexion actually is creating pain.
yeah, that's a lot of what I saw, like, and what I've seen in the past too. Like, too much flexion is actually bad. A lot of people actually prefer extensions. Like, that's why a lot of like ergonomic seating chairs and stuff for people at a desk, it's actually to put a pillow, I think it's right here, right, to get that extension, and then it makes sense, right? Posture, yeah.
I think that, sorry, about the low back thing, I think that we think a lot of times in coaching that if someone's having lower back pain, it's because they're not pressing hard enough. You know what I'm saying? But sometimes now, especially after this, like maybe take it to another approach. Like, okay, maybe if I allow them to have it, like my back's off the floor right now, but I don't have back pain. If I go like this, I have back pain.
But
Yeah.
so like, very contraindicated.
Uh,
I mean, like, but they're not doing as much in the stomach, so how do we know?
Yeah.
You know what I mean?
I'm putting it way more in my stomach when I'm an extension and I'm pressing.
Some people actually, yeah, I've actually seen that a lot lately. Like, if someone's pressing really hard into the floor, they're feeling more of their back than actually their core.
Yeah.
So like,
My abs a lot more. Even if I grasp it, like I feel my abs way more here than I do here.
but I think it depends on the person, right? It depends on the person, depends on like how you're coaching it, depends on what they're doing, depends on their history of their pain. I think there's a lot that goes into like, I don't think you can. You can't like, but I think just maybe knowing more about like, hey, this is maybe something that you can look for like these signs, right? So what, back pain, running down the leg, tingling, numbness, right? Maybe they have a history of a disc herniation, or like maybe they know they do. And then maybe, right, you can go into that aspect. But if they have other back pain, I still think a lot of these exercises will be good.
It's like everything in my body though. Like I used to think that like a neutral grip on things would fix a lot of shoulder pain, and now no, it really just depends on the shoulder injury. Like
Yeah, it depends on
this actually feels better than this, right? So like that's why it's the same idea when you're coaching anything, you have to have an open mind for like, hey, this actually made this client hurt, but it's making this client feel good. Why is it different?
Yeah. Yeah, I don't think you can like actually like pinpoint. So that's where like this is basically the end of my thing. I just had should we have a test prior to loading someone? But like I don't know that you can, but like I wanted to know your thoughts. Yeah, like a deloaded squat, and then a body weight squat, and then a loaded squat. Yeah.
You help build confidence with that kind of thing.
Yeah.
Versus doing it the opposite, right? So you do it the opposite, then you're helping that person.
I mean, the
lose
other way,
confidence.
I don't know if this is compression, but I was thinking something that's simple. So I'm always thinking simplicity. We talked about this test for abduction, single leg. It's impossible to like do a test on somebody except comparing their legs opposite to each other, like pulling in. Abduction, sorry. But for this, the other way you can find out where if they're the type of person that hurts a lot when they're flexing too much is through a pressure gauge and find out at what point in the pressure gauge do they start hurting. That would be a simple way to find out.
Yeah.
If they start hurting
Like
at all.
laying down on
Maybe
their
some
back.
people that don't hurt at all when they're
Yeah.
flexing as hard as they can to control.
Yeah.
And the pressure gauge is over 100, like right there.
Yeah.
And you have people at 70 just flexing on their back. It's like, well, let's keep it at 70. You probably have to stay there.
Yeah. I know that like when I listened to my sister's dissertation, she said that you can't tell, like all of our spines are probably all different in here, and like we can load, like I'm more comfortable loading front than I am back, right? I have different hips and all that stuff. So you can't actually see that or test that on everyone's different spine. So you won't ever know that until I think like trial and error. And I don't think you can ever test like front or back. I think you have to go off how someone feels.
Your maximum testing, like a 1 rep max. Unless you, I mean, that's the only way to test compression.
Yeah.
Spine is to break.
Yeah, but you don't want it to break.
Oh, it broke.
I mean, the other way to look at it too is how you started this out by saying like a lot of the weaknesses you're seeing on this type, at least if we're focusing on are just
On the disc, yeah.
this is weakness in the spinal area, right? So
Yeah.
you could literally, if you know someone has a disc injury, you don't ever lay them down for at least the foreseeable.
Yeah, you work there into.
Have them standing.
Yeah.
Have them stand up tall. Have them stand on one leg. Have them
Mhm.
gaze, whatever it is. But like, you can also, because a lot of times, like, putting people in different positions they're not used to, you know, like then you have to figure it out all again. But like, the thing is simplicity. You can just keep someone standing.
For a while.
Yeah,
I
for a
think a
while.
great example of that is Anne, right? Like Anne can stand with like she walked without her walker, right, the other day, like, but she's been doing like you programmed a lot of like just walking laterally, walking backwards, walking forward. She's walking more and she's actually like standing more, so she's working.
Yeah.
I think that's a great example too.
Yeah, because I mean, it's like, I always think about the amount of time people are working against what we do here is so much greater than you can never compare to it.
Yeah.
So you might as well, if you're gonna have it for an hour, you might as well keep on the feet the whole time. You know she's gonna go sit in her chair for the next 17 hours.
Yeah.
And I also bring up a volume. I mean, you talked about volume, like, hey, how do you get to one pull-up? Like, you just do it throughout the whole session, one at a time, half at a time. So, and another thing, if you want to have her walking more, so you can push her spine more after, before you give her a break, and walk there and back, and then come back and give a break.
Mhm.
That's a simple one you do.
Yeah. Oh yeah,
Three,
for
six,
sure.
This 9 sets, that's 9 times.
Yeah.
You know?
Yeah.
Volume. That's good.
I don't know. I mean, after I listened to my sister's thing, I was like, oh, I've never thought of the spine like that. Like when I load myself, like meaning loading my spine, I never thought like, oh, this is how I can like get a disc herniation. So I just thought it would be interesting to show you if you never learned it, you probably.
I mean, it's such a hard subject because you can have two people, the same fitness level, working out at just as much intensity, and number one ends up with a disc injury, and number two ends up like tripling their back squat and never has an issue.
Exactly, and that goes back to the that one article where it depends on genetics, right? Everyone's genetics are differently, and so some genetics are able to squat and some are not.
But
Yeah.
also, only because of the past year, I've seen that the spine is extremely plastic. Meaning, like, you can train the spine to be extremely plastic. Huh? Plasticity. Yeah, plastic. Short for it.
And that's the thing though too, is like what I see is like there's so many people that have like a different point of view on it all.
Yeah, I agree.
And
I think that if it becomes like a stenosis, it becomes fusion. You're talking about a different story. You can't get out of that.
yeah.
But if it's before that, you might. That's what I'm saying. Yeah, you're
But
right.
I think the fusion and all that happens because of stuff like this.
Yeah.
Yeah.
And I don't think anyone's arguing that.
No, No, I'm just saying it's because, like, for example, like at the same time, if you baby the spine for a certain amount of time because you're getting too much compression, then you're never going to build up the resilience.
Oh yeah, no, but I mean, you got to do it in a way, and that's what I'm talking about. Is like, I'm not saying never load the spine.
You progress it, like,
That was my question. It's like, when can we progress it for someone?
yeah, you're right.
I like the idea of deloading body weight and then loading,
I think.
and then that whatever that term is.
When I have a month, I usually program 2 months, 2 weeks really hard, like up, deload, up again.
Yeah.
That's what I usually plan. I'm planning to now their deload week is the first week that teaching in the program.
Mhm.
Usually go from here, right?
Yeah.
So I don't think about deloading in
And
the
there's a
order.
major difference between having a deload week for someone that works twice a week and having a deload week for someone that works 5 days a week.
Mhm.
Someone that lives 5 days a week needs a deload week much more than someone.
And then the other question I'm gonna ask you is, did you look into traction of the spine with disc herniation?
No. No, but I have an article that basically I was reading. Let me see if I can find it. But it was on athletes. It was on athletes, and what they did was they took. So this athlete, they found out they had a disc herniation, right? They're in so much pain. They don't have surgery. And then they try to like slowly decrease the pain to get them back into,
But how are they doing this?
so they're doing like stuff like traction. Like I think in a way of traction, like a spinal load is a traction. And spinal load or spinal wave is a traction. I think so. Hanging is definitely traction.
What is the first thing you said?
I think.
Hanging, I'm sorry, traction is what?
I think a spinal wave is a way of attraction, of a, no, not track, yeah, like a traction, is that the de-unloading? I think that's a way of de-unloading the spine, traction, and spinal wave. But yeah, that article, I'll see if I can find it, but that article took athletes, which we don't really, I mean, we don't have that, but they took them without surgery, pain-free, trying to get rid of pain, and then trying to,
They read studies on